Welcome to How to Educate Yourself on GIST Research, searching for the web for GIST science publications. During this seminar, all participants will be in a listen-only mode. There will be a question and answer session at the end of the presentation using the questions submitted through the Q&A feature in Zoom. Please remember the information provided in this webinar is not intended as a substitute for your physician's guidance and care. My name is Denise Evans, Senior Director of Data Management and Research at the LifeRef Group. We would like to thank our sponsors Blueprint, Cogent, Genentech, IDRX, and Decipher for their educational grant for today's webinar. And now I would like to introduce our presenter for today, Jim Hughes. Jim attended Kenyon College, Ohio, and Loyola University in Chicago, where he earned a BA in philosophy. Between schools, Jim served as an officer in the United States Army and served in Vietnam, and followed his service worked in the telecommunications for 35 years. Jim and his wife Margie are the parents of two children, Nancy and Jamie. Nancy Hughes Welsh was an early member of the LifeRef Group in 2002. Nancy was diagnosed with leiomyosarcoma in 1991 at age 23. After 10 years of surgery and chemotherapy, Nancy was re-diagnosed with GIST in 2001. Nancy participated in the phase 3 imatinib trial in 2001 and the phase 2 sunitinib trial in 2003. Nancy's GIST was eventually diagnosed as sdh-deficient and passed away in 2005. Jim serves as a LifeRef Group board member, our clinical trials database coordinator, and is a founding member of the LifeRef Group allergy science team. Welcome, Jim.
Thank you. Can you hear me?
Yes.
Good. Okay. I have a presentation which I would like to share with you. So I'm going to try and use the share on my screen here. Hang on. Here we go. Okay. And there should be a slide up that says something about how to educate yourself on GIST research. Hopefully that's on the screen. Everybody
Yes.
see it? Okay.
Yeah, we can all see it.
All right. So it's a little bit off. The screen I'm watching and looking at to see these slides is a little bit off to my left. So if my picture's on the screen, I'm looking to the left. I'm not looking away. I'm really looking at the screen with the slides on it, so I know where I am. Okay. I am going to go fairly fast. I have a lot of detailed information. And I hope you have good time at the end. I want to reserve at least 10 minutes for questions at the end. So I need a cue at about 20 minutes to the end so I can speed up and get through this. I designed this in order for somebody new to begin to use some of the resources, but I also realized that our own science team has a resource that I'd like to talk about. It's the Zotero database that we're using. And I'm going to do a little bit about that. It might be a little more complicated for the beginner, but it's something I think anybody could use. And in the form we have it in, it's something I think we all be able to use. So with that, I just wanted to show you a few pictures. This is the story of Nancy that Denise was so kind to review, just so you got to know her. I took this in the late 1980s at about age 21. Nancy was just about 2 years away from being diagnosed. And this was taken on April 9th, 2005. This was about 3 weeks before Nancy's death. And we were out to a concert, and we were actually listening to the Irish music group called Alton that night. And that's my son, and Nancy is there on the right. So her death was very sudden, and she passed away on April 28th, which was just 2 days ago. So we celebrated that this year. My son went up and put flowers on her grave. Okay, I help patients learn about their GIST by referring them to resources. I also help them form questions. I'm not a medical professional. As Denise mentioned, I had a career in telecommunications. But I've been working with the science team and with the LifeRef Group since 2003. I've been on the board since 2005. So I've had some time to think about it. Okay, just for data's sake, this came from Google on their generative AI health project here just about a month ago. And the shocking numbers are approximately 30% of the world's data volume is being generated by the healthcare industry and is growing at 36% annually. That includes a large portion of things that we're very familiar with and important information about patients. They note their histories is often buried deep in a medical record, making it difficult to find relevant information quickly. Just so you know, I put a note at the bottom. PubMed indexes about 500 GIST papers a year. We are a very tiny part of that, but we're a very important part of that, as you all know. And we're working real hard to get our grip on all of that information. So why learn about GIST, where to learn about it, how to do GIST research, and the value of collaboration while you're learning. What do patients ask about? What are their interests? I asked Denise and Sebi to give me a list of common questions. They made this list up. I color-coded them into managing risk, treatment options, and managing side effects of drugs in cancer. Risk is a very interesting topic. It's changing. We're trying to implement a study that will improve our ability to estimate risk. Treatment options are a continuing item of discussion as we see new drugs come online and as we learn that patients have, based on mutations, have different optional pathways they may want to go. And side effects and trying to live a solid lifestyle on cancer is a subject that's not really scientifically studied and talked about as much as it is colloquial, anecdotal, and a lot of information is out there that you have to sort through about what's the best way to handle a particular not so good side effect. So why learn about GIST? It's about you. It's a rare disease. You can be a better manager if you know more about it. You want to understand your options, and you want to be a better advocate for yourself to get those as second opinions. You know, in this context, every patient is different. And so you're learning about yourself and how you compare to what the research says, where do you fit in, and how will I be able to manage my particular case better. With your local provider, you are more a co-pilot than a passenger today. You really do need to know what this disease is about because it is rare and there isn't that much expertise at the local level. They're familiar with it. Imatinib is often dispensed. And our understanding of when you need to get a second opinion is if you're on imatinib, you probably need a second opinion. It's all about us too. Why learn about GIST? It's about all of us. If you learn about it, you'll be able to help others. Learn about their GIST and advocate for themselves. You'll be able to be engaged to help bring patient perspective to design of clinical trials, GIST research funding decisions, things that we all are involved in the LifeRAF group. You can be an active member of the LifeRAF group, helping sort through the various issues that we work with daily. And you can be actively involved in managing and finding a cure for GIST. And it just feels good to know more about what this scourge is. Where to learn about GIST research? I'm going to talk about 3 things in particular: PubMed, Google Scholar, and Semantic Scholar. And then in general about the semantic search engines that are out there. You're probably familiar with ChatGPT, Copilot, and Gemini. OpenAI makes ChatGPT, Copilot is Microsoft, and Gemini is Google. PubMed has 37 million medical research papers. Google Scholar over 6 million, and Semantic Scholar has 218 plus million papers from all fields of science. And they add some interesting too long don't read criterias and explanations to papers. So it's an interesting tool that may help patients simplify their search and understand the answers quickly. So we're going to talk a little bit about that. Where to go in the National Library of Health? The National Library of Medicine actually is buried in the National Institute of Health. And the National Center is underneath the National Library of Medicine, the National Center of Biological Information. The NCBI is responsible for PubMed and PubMed Central. They're also responsible for 36 public databases, including those 3 or 2, and one more that we're going to talk about, which is medical subheadings, MESH. So with a free login, you can get on board, and you don't need it, but you can save searches. You can have your most recent results emailed to you, and you can create collections. But without it, you can still access and use it. So the 3 we're going to talk about, PubMed, PubMed Central, and the medical subjects headings. The medical subject headings is interesting. It's a system of like an ontology. It's categories of disease, drugs, medical conditions that they classify these papers with. And if you use the MESH terms for GIST, you're going to definitely see papers that are specifically established and about GIST. So GIST is a MESH term that was established in 2005. Before that, papers don't have it. So if you're looking for things that's historic, you need to look beyond the MESH terms. As I mentioned, there are 37 million citations in PubMed. Getting an ID, you can use a Google account, a Microsoft account, or a login.gov account. As you can see, I'm logged in here with a login.gov account. I had to get it to get a passport. So many people already have it. I've used it for other things, interfacing with the government. So it's a very common one. It's an authenticator, and you may be able to get it as well. This is the page that you would normally come to if you're going to search PubMed. Anybody can use this. I'm logged in here, but this is what you would see it if you were not logged in. So you start here by typing something in. I typically use the advanced search, so I push the advanced button and go from there. This is PubMed Central. It's also another database, and the difference between PubMed and PubMed Central, PubMed has abstracts, which are short versions of what's in a study, and they have a lot of metadata about the study, so they have a lot there that you can begin with. PubMed Central is a full text archive, and you can search full text in PubMed Central. I don't typically use this. Typically what we do is we use PubMed, we find the article, we find out if full text is available. Typically it will be if it's in PubMed Central, so we have access to that. We can always get that. But otherwise, we may need to find a way to get full text and analyze that. And members of the science team have been able to help us with that. So we have stored a lot of full text articles that were perhaps cost money, but we were able to access them for free. So the first thing you do when you're looking in PubMed and you want to do an advanced, this is the advanced form of the search. You want to pick a MESH term. And in this case, what we're going to use is we're going to use gastrointestinal stromal tumors. That is the MESH term there on this page. And we're also going to add a term, just plain old gastrointestinal stromal, to search titles and abstracts, because it turns out that the MESH terms were applied to a subset of the papers, and some papers are about GIST, and the title and abstracts will tell you which ones are. So if we search there, we're also going to get another about 2,500 papers that are pertinent to GIST. So this is the basic beginning block that we're going to use. So here it is here, we're entering it in. You can see the term shows up, and you just need to select it and then click add to add it to your search. So here's a search with just that term. We get 7,900 papers. Here's a little graph of when these occurred in time. Just wasn't really a thing until about 2001. So you can see most all the action has been since then. Roughly, there's about 400 or 500 papers a year there. When you add the other term to the title abstract, you get all 13,000. I found out today that you can just type in gastrointestinal stromal tumor, forget all about these MESH terms, and you'll get about 13,489. Again, you can see the graph of when they occurred. And these before and about 1947 and forward, there's just not really about GIST, because the term didn't come into use until the mid-90s. So here's what your results will look like. In this case, this is a PubMed Central search result. And I just wanted to point one of these out. It's sorted in default order. It includes 63,000 results. Those aren't all papers about GIST. I don't know what they all are. I haven't really used it that much. but you'll find that this can be useful if you restrict the search to either gist only papers or find a way to enter data there that does not get all these other papers. So some notes on searching. Searching is like cooking. When you begin with a beef or chicken stock, you use the terms gist to get you in the door on gist. So they're sort of the base, and then you add other ingredients. So some useful PubMed search terms that I use are in all fields. I can enter a text term or an author if I want to restrict it to, say, a specific author in gist. Typical one that might be Heinrich, for Mike Heinrich, who has authored many papers on gist. The date of publication, if you know what time frame you want to look at, and restricting to the title or abstract will help. Using terms there will help you refine your search to things that are germane to your interest in gist, that are specific kinds of things. And things that I might put in there in the all fields terms to study gist might be a mutation, or it might be a cell line which has a specific mutation. This tells me I'll get papers that actually discuss these specific types of gist, or a clinical trial if I want to see what papers have been written about this trial and what information is available in addition to what the trial published result was, or a drug. In the case of imatinib, I might want to study the therapy, the dosing by using dosages to manage your therapy, therapeutic dose management. And so I would use imatinib in therapeutic dose management. I wouldn't use the term gastrointestinal stromal to do that. Also, if I want to study a side effect, hypothyroidism, I just might study that alone, or use that here alone as a term. Also, you can use custom filters. I've added filters on so I can restrict it to case reports. Typically, I don't want to use case reports. I want to exclude them. So it's nice to be able to say in my search, which is called a Boolean search, not case reports. And that will exclude case reports, so I'm not wading through 4,000 of those. So if I want to see a systematic review, which is a very high-level evidence-based medicine document about gist, I'll use the systematic reviews filter. So you can add these in as you want, and you can use them as you see fit. And you can see here the numbers of papers we got against the all 13,000 for those kinds of searches. Okay. So notes on searching. PubMed search entries can lag behind the article publication date. PubMed indexes them, and sometimes they don't index them for a couple of months after they're published. And I mentioned when you're searching for toxicities, you may not want to search under gist, but just use hand-foot syndrome, for instance, and or something like the topic imatinib therapeutic drug monitoring. If you're researching a rare form of gist, you need to add a qualifier term. So sdh-deficient, NF1, PDGFRA, and then D842V or exon 9. Searching on a specific resistance mutation or mutation combo can sometimes find insights about drug sensitivities. So it's a very interesting way to discover where you might have some options if you're struggling to find those. So saving a search, I won't spend a lot of time on this. I just want to show you can do it. You can do it in PubMed by clicking the save option. Here I did it against the all 13,000 results page. Here is my personal YNCBI dashboard. I have a bunch of searches there. Some I haven't used for 15 years or more, up to 15 years ago. Others that I'm using daily. I highlighted 3 of them here. I'll just briefly go through those. If you do a save search, yours will show up here in your MyNCBI dashboard after you've created your login. And you can see over here your recent activity. So if you want to use your login page or your dashboard page, you can quickly go back to see what you've done most recently. So here's a search for the one I created to get a daily output, an email, a summary report of 10 items that were published yesterday about these terms in gist. So among those 13,000, there's maybe one a day that I'll get using that term on this particular search. And it's a great way to learn about gist. You're looking at something that comes in every day. It's sort of saying, hey, here's something that might be interesting to you about gist. You click on it, you look at it. If it's not interesting, you don't save it. If it is, you do. And you learn more. This one here is a author search for SDH-deficient consortium authors. These are the members of the SDH consortium for the LifeRef group, and I want to see anything they publish. I'm very interested in that subject. It's very rare, so anything they publish, I want to see it. They don't publish that much, so this is not kicking out a lot. I've got it on a daily basis, so I maybe get one a week or so on that one. And here is again a subject one without any gist filter or add-on. Again, I'm looking for SDH deficient and I'm getting it daily, and there's really not much shows up on that one at all. So you can build searches various ways. It's really great if you'll use different terms. If you're working with the LRG science team, it'd be nice for everyone there to have a slightly different take on what to search for. So having slightly different search terms would enable us to specialize and be able to report back on specific papers that might be missed by others and give them a real thorough overlook. So here's an example of an email I got with search terms or with papers. This one came in this week or last week. Notice that this one has a free PMC article with it. That means I can get full text. I'm not guaranteed that on these others. I have to go to the actual publisher's page to find out if there is a full text. So in summary, you can create a free MCBI account, search PubMed using mesh terms, or search PubMed Central using full text search for the actual full text items that are there. Of the 13,000, I think probably about a fifth of those may be in PubMed Central. So you actually would find that that might be valuable if you're using it without using anything else to search for full text. Search online and save your search. Then your citations may have that PubMed full text, and then you save those locally somewhere where you can read them, analyze them, and share them. And we'll talk more about that later. Okay. So Google Scholar, another search engine, it's out there. What's it good for? It's a lot simpler. When you want to use Google Scholar to search for the 6,000 medical citations that they have indexed, you can look anywhere in the article or in the title of the article, look for authors, the article journal, and what the dates were. And you can do all the words or the exact phrase or one of the words or without the words. That's very nice. Very simple. And here's what you get back. In this case, you want to click abstracts because everything is a lot. Note that in full text searches, the full text of many scientific articles will include a reference to something about a paper about GIST. And they won't be about GIST, but the fact that that reference is there will make that paper show up in a gastrointestinal stromal search. So you want to narrow your search to abstracts, which do not have that reference list problem. So in this case, I did since 2004. I sorted it by date, and I included citations. And you have some nice things here. You can save these. You can get the citation. You can see related articles, and there are multiple versions depending upon where it was found on the web. And this one here is at Biomed Central. Okay. Here's the Google Scholar alert. I set up a search. I can create an alert. I really want to be sure I don't click the less relevant results, so you don't want to use that option. And you'll get your emails directly sent to you with Google Scholar results. Semantic Scholar, it's separate from the National Institute of Health. And there's a nice article or what are the advantages of it here in Quora, explaining the differences between Google Scholar and Semantic Scholar. It has, we'll see in a minute. I'm just going to go straight to it. There's the link for it. Here's the search page. I just put in gastrointestinal stromal. I didn't use tumors. This is the exact phrase. I picked a date range for 2024. And I got back, I think there were 211 results. But the limit on this one is that only the most 100 relevant are shown. In this case, I sorted it by date, so it's not sorted by relevancy. We're interested in getting the most recent ones as science team members. So at this point, we want the latest, not the most relevant. If you're searching on your own for a topic you're interested in, you may want to use that most relevant frequently. The nice feature of this particular search engine is it gives you what's called TLDR, too long didn't read. For those of us who like short abbreviated summaries, here is a machine-generated summary for this particular paper. So this makes it really easy to get the gist of what's in there. That's a pun. And so Semantic Scholar does have its uses, and you might find it very handy as you're starting out. And again, alerts are possible. You can create an alert using alert preferences. Here I have one alert in there for sdh-deficient gist. I think I've included some seed papers in here that I've marked and saved, and it's basing my alerts based on those seed papers of what I've used to create the seed, which is maybe a general overview of sdh-deficient gist. For those of you who are on the science team, this is more for you. There has been a recent paper published by the NCBI about what is relevant in searching in the context of AI. And it's a very interesting paper. It's almost, this talk could be done strictly about this paper here. In the world of evidence-based, that's EBM, a medicine, which is what we typically do. We're looking at evidence-based research for GIST. We want to select a particular population, let's say imatinib responsive patients. We want to use the intervention imatinib. We want a comparison overall survival or an outcome overall survival, and we want to be able to compare different populations. Let's say imatinib sensitive and imatinib initially resistant. And so the results will come back in terms of case control studies, randomized control trials, papers about those, critically appraised topic and systematic reviews. And the evidence quality varies based on the kind of study that you return. So the higher quality is systematic reviews, the lower quality is case reports. And these will, results will rank high in your results. And in searching PubMed, today they are doing best match, and these result ranks are becoming important in PubMed search results. So here are the different areas of interest in the cases of why you'd be doing research. Evidence-based medicine is where we are. We're beginning to learn about how to do precision genomics, precision medicine and genomics. And we're using the PICO terms to do evidence-based medicine. Remember, the PICO terms are these terms here: population, intervention, comparison, and outcome. So these different use cases are used to characterize the different kinds of search engines. And in a second here, I'll get to it. But here's an example of trying to search for genes in the literature. The problem that happens is that there are very many genomic variants. And when you do a query, there's no standard way of actually labeling that variant. So these variant synonyms are really not returning easily. They're not easy to use as search terms. We're used to using these keyword-based searches, and these are kind of hard to do. So not only that, but the search engines that are out there to find these particular kinds of things are rather closed, and they're rather difficult to use. So there's a real problem there, and there are specific search engines coming out are trying to deal with this problem, as we are. So here they are, the ones that we typically use for general purpose evidence-based medicine: PubMed Central, and I learned there's one in Europe. We don't use it, but it does allow you to search both full text and abstracts. And here are some that are coming up in that same area that are more focused. The Cochrane Library we know is out there. It's systematic reviews only. It's highly regarded. It's the best evidence out there for any particular medical subject. But I believe it's a paid for, even though they say down here that these are web-based, freely available. I believe that's a paid for one, and it's something we don't have access to. And then here are the ones that they're talking about that are not commonly used, but they're trying to get more people to use them. to help look for precision medicine and genomics. And these are things we may have to explore with our science team and on our registry as we try to understand how to search for variants and what they mean for patients, because we're seeing more and more mutation reports that reporting different kinds of variants for different genes, not only GIST, but genes that might be related to the severity of the disease. Excellent paper. I'd recommend it for the science team to read. So large language models, they're out there. We're aware of them. I have tried to use them. I find that I use them typically to search for terms and plain language explanations of terms I'm reading in the literature. We're not so much as the science team looking to explore in depth a particular topic in GIST as we are trying to stay on what's the most recent research. So the recency of it and the authorship of it and the relationship to the current management of GIST, or to options for patients looking for new therapies that are evolving, and we want to understand where they stand in the translation process of a bench to bedside. So, but these are important, and they're going to become more important as we try to mine the literature to get more out of the literature. And basically today, I use them in conjunction with Wikipedia and Google search just to get a quick answer about something that's a rather complex subject. How to prepare to do research. I've listed two references here that are of the nature of the high-end reviews. They're written by subject matter experts in GIST, and these two research papers, they're a little bit old, 2022, but they are really the latest in overview of the overall topic of GIST, what therapies are available, and what the issues are today. So I highly recommend these to begin with if you're going to start doing GIST research. Reading these and reading them again, doing the process of absorbing them and asking questions if you have them, really be a good place to start, just to get a basis. Grasping some of the basic concepts is also something you're going to face. One of the things we have to deal with is statistics. Not a fun subject. I confess I didn't do well in statistics in school. I took a class in it, and karma would have it, I'm paying for it lifelong, because we're dealing with these daily. And these terms, p-values, hazard ratios, and Kaplan-Meier, which is a graph here you commonly see in a GIST paper, need basic understanding. And there is a place to go to get that. And I wrote here, see Steve Dunn. A little bit about Steve Dunn. I met Steve Dunn in an ASCO meeting in 2003. He was a kidney cancer patient who had survived and was no evidence of disease in 2003. Steve passed away in 2005 of spinal meningitis. Like him, I am asplenic, and it's a problem when you're asplenic when you get a bacterial infection. And Steve was susceptible to that, and he also wrote extensively about what to do if you're asplenic. Well, I met Steve in 2003, and I knew he was a great resource, a really unusual guy. He's not trained in medicine. However, he had done a lot of research in cancer and published a webpage called Cancer Guy. And after Steve died, it hung around, it deteriorated, and it went offline. A patient found it using the Wayback Machine, probably because you can find it there, you could, and restored it. Got some money from ASCO, actually, and it's still the original site. That's the original, was put in 2005, but it has useful information, particularly about statistics. Steve wrote a really good guide. You can find it here at this URL, and the sections on statistics and cancer. And I highly recommend reading The Message. The Median Isn't the Message, an essay that Steve put in the middle of all the statistics to help you understand what's important about statistics and how to read it and how not to be overwhelmed by it. Steve also has an interesting session on researching your options, and you can compare that section to the article we just went through about AI and the different research engines that are being promulgated today and what their value is and how to use them. Very interesting. The approach is probably the same in the mental approach to it, but the tools are different. Seek evidence-based research. Understand the kind of study you're reading. It impacts the evidence quality. And I listed these in the study types in lower to higher. So case studies are at the bottom. They're simply a report of a particular patient, but they're interesting if you have a particular rare form of GIST. You might find a case there that's very close to yours, and you can read specifically about how the particular center managed that case. So single study retrospectives, anything that's retrospective is not the same quality as prospective. Population-based is really, in some cases, all we might have about a rare form of GIST. The sdh-deficient GIST was studied extensively at the National Institute of Health, the National Cancer Institute, and the Pediatric GIST Clinic, and they published in 2017 or so, and it's a benchmark study about the natural history of sdh-GIST. It's a must-read for all sdh-GIST patients. Prospective non-randomized clinical trials are the next level. Randomized are the next level, and systematic reviews on top of that. So know what you're reading, because it makes a difference in quality of evidence. Qualify the source. Is a well-regarded journal or website? You can see from later information here who are the researchers that we typically follow and which ones are most published and authoritative in GIST. And are they? You want to ask yourself that. And if you don't know, ask somebody else here. Was the study peer-reviewed? Are there conflicting declarations of interest? Are there conflicts there? What's the status of the report? We're seeing more and more manuscripts and preprints today. Is it a published report? Is it peer-reviewed? What is the quality of the data? This is a more detail. I won't go in detail here. Cohort size is important. It's a problem for us. Large cohorts are very important. We're seeing very large cohorts in China and also in Europe, where medicine is centralized and they can access data from all these tertiary centers and come up with significantly large GIST patient cohorts. In small GIST cohorts, rare GIST forms, we'll always have that problem of small cohorts, and you're always going to be dealing with it. So the numbers are small, and statistically, you have to be very careful with the data. In some cases, you look at the data and ask yourself, if I knock one patient out of this trial, would the result be different? What are the selection criteria? When selecting patients for a study, what was the selection method used? Are all included members truly members of the cohort? So you can ask yourself that question. Is there evidence bias? Studies done at major sarcoma centers can suffer from center bias. Patients able and motivated to travel away from home are a higher proportion of those studied. So it's not as diverse a study population, and they may be more severely ill. Real world data. If you're reading real world data differs from clinical trial site data acquired in clinical trials. Know that mitotic index and progression data have a degree of subjectivity. They're read on a screen just like you and I would do, looking at a photograph, and you're trying to count very small things. So they're not only quantitative, but they can be read differently by different groups of people. Patient-reported data is difficult to normalize. Pain is an example. So reading tips that may work for you, or they just maybe my bad reading habits. In the abstract, I read the conclusion statement first, then I read the rest of the abstract and look for the key points supporting the conclusion. Then I read the more detailed conclusion and the full text. Then for those that pass muster, I read the full text. Look up words I don't know. I have to do that even when I think I know them. They don't sound right to me in the context they're in. I look them up again and I learn something. If you can actually use one word or one note and use the mic input function to transcribe your voice to create notes. If you're using Zotero, which we'll talk about, you can actually annotate the PDF in Zotero. A confession, I don't read the method section. They're very difficult. They're very technical. And then I recommend always reading it again. I learned as much in the second as I do in the first, and repeat as needed. I've read some papers 3 and 4 times. And I've gone back to read ones I read a long time ago, and I always learn something. Well, I use a reference manager, and we have created there's a website to find LRG curated research papers. We have created them in Zotero, and we have 1,300 some papers in there now. We've been doing it since 2015. There's free full text where available, and we have team tags and notes and comments, so they're curated. and it's publicly accessible. If you go to this link, you don't have to have Zotero. You can use your browser and you can see our research library. This is what you'll see when you get there. I am not logged in here. I wanted to show you one where the page says log in. If you click on the next, any one of these documents here, you'll go immediately to the full library. These are just the most recent ones. And the full library looks like this. Here are all the papers. I believe they're in order of date. So date published, I think I got it, that one right. They're also here in date added order. That's the date we found them and put them in there. So they're typically the 2024 ones are all entered in 2024. But if you use the date added, you can find stuff that we've gone back and found important that was done in 2021 that might show up at the top. Here is the basic parameters about the study, who was in it, who wrote it, the article, the publication that it was in, Cancer Research. If you want to find it, you can use either the URL and go to it on the actual publisher's webpage. The same thing is true of the DOI. You click on DOI or this URL. These two items here, click on either one, it'll take you to the paper. Over here are papers we've marked for our own internal use to talk about. And so these we consider the more important papers. You'll see those little marks there. Clicking on any one of these by itself will bring up, will take you to the link or to the full text. So this is a really great resource. It's already there. It's as useful to me every day as PubMed. And I use it frequently. I'm in it every day. So how to get it? You can get it free, download the client and the connectors for your browser. In a minute, I'll show you how to do that. The free version gives you 300 megabits of storage, and there's the download link. And you can manage your own citations locally. This is a good way to store them. You can use it for Windows, and it has here the connector for Firefox. They've got those highlighted, but it's available for other platforms. So it also has plugins, but not getting into the details of that. You can go ahead and just click on one of those and get to the download page and download it, install it. Once you've installed the client and the connector for your browser, there's connectors for Chrome, Firefox, Edge. I use Firefox. Here I'm on an ASCO pub. I'm reading a PDF file. It's in my web page. I go to this icon in my menu bar or my address bar. It's the Zotero icon. I click on it. It says, do you want to save it to your Zotero folder? I say yes. Save it to LRG distribution team because I want to share it. And it gets shared. It gets stored in Zotero to my Zotero folder for everybody that's looking at Zotero. You can store anything there. I showed you a web page. In addition to web page, you can do all of these things. Scientific reports, journal articles are in here. Anything really that you find online, you can. There's a format for it in Zotero to store it. So who was the research team? Here are all our research team members. I think there are maybe about 20 of us there. If you have a how to research question, you can send an email to our team. This is our Google group, and we use that to communicate papers and set up meetings and back and forth. So if you just want to write a question to that group, somebody can get back to you and help you with your research question. So you might recognize some of those names there as folks who are with the Life Raft group or who post on Just Chat. The value of collaboration, my last topic. Activities that require collaboration will really sharpen your knowledge of GIST. Just being involved and doing something with your basic knowledge, even if you're just starting out. Trying to explain something to somebody is a great way to do that. Somebody you meet or encounter online or at a meeting in your local community at one of your state meetings, you can help by explaining a topic that you know something about in GIST. And doing that, you'll understand immediately what you don't know about it. And today, me explaining something in a meeting with patients, I'm constantly having to go home and take the questions and do the research and write back with the answers I found online or was able to dig out that I really didn't have at the tip of my fingers. I've rubbed up against it, but I didn't have it in words that I wanted to actually give them the actual what was said about it in a paper, an actual reference, evidence-based research. So these kinds of activities will bring you that collaborative experience. And these activities for patient research advocates can be a catalyst for learning. They'll also test your knowledge of GIST. By helping others, you're also helping yourself, and you're preparing yourself to help the LifeRaft group move through our job of finding a cure for GIST. So resources I use, this is a very, I wanted to save this one side towards the end. These are things I use daily, and I included in here my Twitter feed for the list of 66 sarcoma specialists. If you copy and paste that, you'll go to their Twitter feeds. I did that this morning, just went there, I hadn't gone there in a while. And the first thing that came up was a post by George Dimitri. It was a post about the Rolling Stones performing in Houston last night. It was the video of the performance, and his comment was, "They're all over 80. Go Stones." So, okay. So congratulations. You stayed with me this long. We have some time for questions. And I can now proclaim that you are a doctor of philosophy and GIST. It's a stretch. And that you can now add PhD to your name. Not really. And you have a specialty now to add for your resume. Wait for it. Gistologist. Okay. That ends my presentation. I think, Denise, if you're ready to take questions, I'm ready to try to answer any questions folks might
Yes.
have.
Thank you so much, Jim, for an amazing presentation. We are getting some questions. The first one is there a criteria if I want to join the allergy science team? Is the science team recruiting?
I think it's a good question for both of us. Members have been invited to join the team, and we have found that there have been others people who've helped others and have a basic understanding of the underlying science, perhaps from having a medical background or a degree in chemistry or a related area. And coming to that team, the background is not so much important. As you can see, I don't have a background in medical science, but your willingness to dig in and to work with others and to write something, curate something, do something with the information you have is really important. So if you feel incented and you really feel like you have the bandwidth, in addition to managing your GIST, we're willing to take you on.
Yes, and we meet once a month. It's an online virtual meeting, and it's a great group. So if this is something that's interested to you, please contact us and we will discuss next steps. Another question is, are only GIST patients allowed to be part of the science team?
I'm not a GIST patient. Caregivers, Jerry Call is not a GIST patient. Norman Scherzer was not a GIST patient. We've all worked to understand this disease and to help our patients. And in some cases, we have the ability to do it, and our patients don't, because they're really just full-time, just trying to manage day to day. So it's been really important for us as caregivers to try to better understand the disease and explain it to our own family members. So yes, you can be a non-patient.
Great. Another question is, when you save your searches in PubMed, is it just saving the output at that time, but won't give you the new paper since you last saved? Is there a way to save the search criteria and then you just return?
Yes, on the slide that I showed, my NCBI dashboard, all my studies, my saved searches were there. And if I click on one of those searches, it will immediately come up and look for everything with those criteria based on what's in there today. So there's stuff being added daily to PubMed. And so it'll bring those new ones up. Yes, that'll work.
Great. Next question is there a list available of current studies that the LRG is currently involved?
The LRG works on papers for publication and presentation at conferences. And yes, we are in the early stages of working on risk in GIST. Jerry Call is leading that effort with some researchers in Europe, and he's putting together a team to assemble data to do that. It's going to be a very interesting study because we're seeing so many papers about different criteria for determining the risk in GIST. It's a really an active area, and it's an active subject of interest. So there are others. We recently published about using the historic results from trials when patients are randomized to a placebo. We have a history of patients who have progression-free survival that lasts only a month and a half, and it's almost universally the same no matter where those trials were done. It averages out to be about a month and a half to 2 months, and we want to use that data rather than have new patients admitted who might receive a placebo. We want to avoid that. Even though there's crossover and patients can get the active drug, it's still a month and a half delay, and we're trying to avoid that by asking the standards committees to adopt historic standards to use for placebo comparison. So yes, there are active areas where we're looking to publish, and if you want to join an effort, some are just in the talk about stage, others are in the active assembly of data stage.
And we're constantly, every time we're really trying hard to publish all our research and going to all the important scientific conferences and all the results that we do there. We publish it either in our newsletter, in our website, so it's always available. And we try to disseminate the scientific information for the patient community in easier terms to understand. Upcoming next month, there's going to be a huge conference, which is called ASCO, the American Society of Cancer Oncology, and the LifeEarth group will present research as well as be there to feature in one of the panels. So we will share all of those news with the community. So stay tuned for that. Next question is, where can we get a link to your PowerPoint slides?
I can provide the link to the slides. I've also entertaining just taking all the links that were in there and putting them together as a bibliography and just publishing that so you have nothing but links with a brief description of what each one is. So whichever of those two you want, we can do both, or one or the other if you want one or the other. Yes, we can handle that.
And also this session is being recorded, so we will make this recording live in our YouTube page, so it will be also easy to access there. Next question is, how can I differentiate between credible and less reliable sources of information when searching for GIST research I find online?
I think the criteria of look at the publication, is it a reliable one? If you look at our Zotero page, you can see which publications the papers that we've collected are in. And the ones that have a large number will be things like the Journal of Clinical Oncology, Cancer Research, which Journal of Clinical Oncology is published by the American Society of Clinical Oncology. The Journal or Cancer Research is published by the American Association of Cancer Research. Both are very high quality journals, as are The Lancet, the New England Journal of Medicine, and Nature. All those are very high quality journals. So if it's in some of those well-regarded journals, you can be pretty well assured that it's been peer reviewed and it's a fairly solid article. If you can't find either the authors or the publication commonly publishing on GIST, then I would ask somebody what the relevance of this might be. Because truly speaking, we see a lot of articles coming from China and from places we don't typically see or haven't typically seen in the past. And the data can be really good. The writing may not be good, but the data can be very good. So it's really sometimes a call. You have to look and ask yourself, what's in here and what's the value really?
Great. The next question is, do I have to be part of the science team to get access to the publications you find and discuss?
No, that link I published, the Zotero link, you can pull that up today on your screen. You don't need to be anybody in the GIST world here. It's not something we publish, but we're giving it to you today because you're interested in how to research GIST. So it's something that I maintain today under my account. We're looking to move it over to the LifeRaft group, and we'll be doing that shortly. So it's something that we've been doing for years, but we're realizing the value of it, and we'd like to make sure that if there's value there, you get a chance at it, and it can give us feedback even about what's useful and what's not about it.
Great. The next one is, I sometimes get nervous engaging or sharing research I find online with my healthcare provider. Any advice on how to successfully talk to my doctor about the data I read? This is a great question.
Good question. I have sent many papers out to patients and wondered what happened next. It's very difficult as a patient managing GIST to really get the understanding of it, especially if you're advanced and you say you were discovered with multiple tumors and now you're on imatinib and you're worried about progression and you're just trying to manage day to day. It's still, I think, being able to talk to somebody and ask questions of somebody who has read it is really helpful. So I would encourage you to take that paper and ask what you would like to ask your doctor. Talk to one of the science team members or to Denise or Sebi about asking questions. There is no bad question in science. It's skepticism is what science begins with, and so you really have to you have to be able to ask the question. Simply put, don't be shy. Ask. Just step in. The water, you'll find the water may be cold at first, but you get used to it.
We receive a great comment too. It says, for this question, often best to ask the doctor's opinion or state that what you think is correct, it might not be. So it's great to also ask for the physician's opinion on the research. He might or she might be involved in the research as well, if they're
Right.
like in a big academic institution.
Right. I have a statement I want to make before we get through with all the questions.
Okay.
An entry point here for joining the science team is actually finding papers and sending them forward and asking, is this anything you guys think is of value? Sending it to us and asking, is there something here? We'd be glad to respond. It makes us think about what you're interested in, and it gives us an opportunity to talk to you about a subject we have all been learning about and trying to understand. So just an entry point is simply sending an email to that LRG science team group for anybody.
We have two more questions. What kind of audiences does the LRG reach out to? Is it only English or French-speaking ones?
I have to say we are so monolingual. We're trying to reach out to English speakers. Some of us don't speak the same language, even in English. So no, we're not bilingual, and I understand the issue. I don't quite know how to address it. It helps to have patients who are bilingual and can help address our issues and our advocacy to those who might have an interest and are not English speakers. So on our team, we do have some bilingual people, and I would encourage anyone to ask us in the language of choice if we can help. Just can you help with that language? And we can try and match you up with somebody who can help you, because we do have contacts around the world who we've worked with, whether they're pharmas or other patient advocacy groups where we can find somebody who can help with the language and help us with a technical research question.
Great. And one last comment. Someone mentioned it would be great if there was a follow-up webinar on training or guidance on how to effectively navigate and interpret scientific figures, tables, and graphs commonly found in GIST articles. Great presentation.
Well, thank you. Noted.
We will definitely work.
Thanks for the feedback.
All right, so we have reached the hour. Thank you so much for a great presentation. And again, we would love to extend the invitation for all members that are interested in the allergy science team to reach out. We want to ensure we grow potentially to continue to study GIST and understand GIST together as a community. Thank you, Jim, for a fantastic presentation, and thank you to all our sponsors for today's webinar. Thank you, everyone. Have a great day.
Take care.